If you are thinking about going from RN to MD, this video is going to tell you about the 5 different mistakes that I want you to avoid to make your transition as smooth as possible. If you're new here, my name is Lily Nguyen. I am a first-year resident, former registered nurse. I worked in cardiology as a registered nurse for 5 years before pursuing medicine, and now I'm here on YouTube and Instagram to try to help other nurses pursue a career in medicine as well. The first mistake that I want you to avoid is underestimating your value. Registered nurses have so much to offer the field of medicine. You have a clinical background, you're able to collaborate with other healthcare professionals easily, you have direct patient interaction skills, as well as procedural skills like ultrasound IV and assisting with other sterile procedures. Nurses also work in really high pressure, high stakes environments like the intensive care unit or emergency departments. And most pre-meds who are traditionally right out of undergrad do not have that kind of healthcare background or critical thinking skills that nurses really gain from their work experience. Instead of checking off typical pre-med boxes like people who are coming right out of undergrad, as a registered nurse, you're really able to leverage all of these clinical skills that you've obtained in your work experience. I get a lot of questions from nursing students and new grads thinking that, do I have enough experience? Is it okay that I only work as a nurse for 1 year before I apply to medical school? And I think absolutely. Having just even the Bachelor's of Science in Nursing, although it does not fulfill all of your pre-med prerequisites, it does give you a ton of background in the medical field and how to navigate patient interactions, which is going to be so important and serve you really well when you go to medical school. So that's mistake number 1 that I want you to avoid. Don't underestimate your value. All right, let's talk about number 2. Number 2 is knowing your why. This is very important, and why in capital letters. The first question that you need to be able to answer is, why did you want to become a nurse in the first place? Did you want to work closely with patients and help them? Was there an experience that happened in your life that left an impression on you and made you want to pursue a career in nursing? Start there. Start with, why did you want to become a nurse in the first place? Why did you want to work in healthcare? And then open up to how that experience helped you pivot to decide that actually medicine is where you want to go. It's really important to be able to articulate your why, not only because it will help you in your pursuit. The journey is long and arduous to go into medicine, and if you don't know your why, it can feel very, very demoralizing and may lead to bad burnout if you can't come back to and reflect on your why. Not only is it really important that it helps drive you to get you through this long process, but you also need to be able to describe and articulate it with interviewers. You'll be asked, why do you want to become a physician during your medical school interviews? You'll be asked this during medical school because people will find out that you were a nurse and they're going to wonder why you left the nursing field to become a doctor. And just understanding your why will help you answer those questions and also reflect on why this path is right for you. I can tell you that I continue to be asked why I left nursing to become a physician. I answered that question all through my residency interviews, and I know that more people will continue to ask me that as I progress through residency. I want you to be really specific when you think about your why. Did you feel limited in your scope of practice as a nurse? Were there specific things in medicine that only medical school can offer you that nursing school or nurse practitioner education wouldn't be able to offer you? Why is it that medicine has to be the correct path for you? Honestly, your why is not only going to help you with getting through medical school applications, it's going to be what helps get you through all the late night studying and long clinical hours. Let's move on to number 3, not seeking help. Your net worth is your network. Your network is your net worth. Your net worth is your network. I want you to network, network, network. As nurses, you work alongside physicians. They are your greatest asset. Ask them if you can shadow them a couple of hours per week in their clinic outside of your work hours. Ask them if you can stick around after they round on your patients to just kind of listen to the conversation between them and the residents. Ask them why they're doing this particular order set on your patient. Why are they ordering these medications? Why are they ordering this workup? Pick their brains. Get to know the doctors that you are working with. They are your greatest resource. They've gone through what you want to go through. Reach out to them. Ask them if you can shadow them. Once you establish a good relationship with them, you can begin to talk to them about getting a letter of recommendation for medical school. These people are not only great resources to kind of give you an insight to what your future career might look like, they're also going to be the people that help you with getting your applications together and write you a strong letter of recommendation for medical school. They've seen you at the bedside, they've seen your work ethic, and they're able to speak highly upon that for you. Don't be afraid to share with others that you want to go to medical school and leave the nursing field. I know it might sound scary at first, but if you tell more people, there are other nurses that either might be thinking the same thing or know of other people who have gone the same route. Then they can connect you to those people and you're able to grow a community that can lean on each other and share resources. I know that I didn't get to where I am today because I did it by myself. I had a huge support system, people I've reached out to, doctors that I was able to shadow, who helped connect me with admissions committees, and I got here because the help of the community. You really don't have to do this alone. All right, mistake number 4 is really important. I want you to, if you don't take anything out of this video, please make sure you focus on this. I want you to write down all of your experiences as a registered nurse. When things go wrong, I want you to write it down. When things feel really good, I want you to write it down. If you don't have a journal, I want you to get one today. If not, you can even do a notebook app on your cell phone. And when you're at work and you have an excellent patient interaction that really inspires you, I want you to take a moment right after that and jot down some bullet points of how that made you feel and what you got from that experience. If you have a moment at work where you feel like you failed, I'll give you an example. When I was a registered nurse, I accidentally sent one of my patients off the unit in a type of bed that isn't allowed to be transported off the unit. And that moment felt so defeating to me. It was in like my first couple of months as a registered nurse. I wrote and journaled about it, talked about how that failure felt to me, and I was able to draw upon it when I talked about my failures in my medical school interviews later, and also in my secondary applications. I talked about how that failure taught me to make sure that I combed through protocols before I just did things. That failure taught me to not only seek the resources of the veteran nurses on my floor who maybe weren't totally sure about the protocols with transporting patients off units with certain equipment, but to also make sure that I brought up the institution protocols when I was looking at how to transport patients off units. So this is just a lesson to show you that if there are any moments that make you feel a certain way, either really great about something or really not so great about something, write it down, because you can draw upon these experiences to help you create a very strong medical school application later. You will have a bank of experiences to be able to draft from when you start thinking about your personal statement for medical school. If you've already journaled about all of these experiences that inspired you or angered you, I really encourage all of you to start journaling. The last mistake I'm going to talk about is not leading. As a registered nurse, honestly, you're already leading in that role because so many registered nurses are precepting nursing students. Take that role seriously and share as much knowledge as you can to the next round of nurses that are coming through your unit. But I encourage you to not only precept, but also see if you can tutor or peer mentor. Help the next generation of nurses become the best nurses they can possibly be. Like me, you can also seek out charge nurse roles. That's a great leadership position that nurses can take, and it allows you to get paid for your efforts, but also teach you how to lead a diverse group of strong, hardworking nurses. Having strong leadership skills really helps set you apart from other applicants. All right, let's recap on the 5 mistakes I don't want you to make. Don't underestimate yourself. Leverage your nursing experience in your RN to MD path. I want you to seek mentorship. Don't do this alone. Know your why. Be able to articulate it. Document your journey by journaling as much as you can, and if feasible, take on a leadership role. I think These small changes really help you in your RN to MD journey. Thank you for watching my video. If you feel like this video can help other nurses, please make sure you share it. Please subscribe, like, and comment, and let me know what you think, and if you have any other questions. Thanks.